Hello everyone, I am Dr. Surapaneni Krishna Mohan, Professor of Biochemistry, and I am delighted to share with you the vision behind my book on early clinical exposure in biochemistry. As you know, biochemistry often feels abstract, filled with complex pathways and reactions. My aim in writing this book was to make biochemistry meaningful, practical, and deeply connected to patient care right from the first year of medical training. The National Medical Commission has mandated the Competency-Based Medical Education curriculum and recently revised the curriculum in 2024, where it is emphasized that the medical students are not just passive learners but active participants in the clinical care right from the very beginning of their training in medical school. So, early clinical exposure or ECE bridges the gap between what you learn in textbooks and what you will actually apply in hospitals and clinics. So, instead of seeing biochemistry as isolated facts, you begin to see how it directly relates to real patients, real symptoms, and real decision making. The unique features of this book are: this book introduces you to 100 essential clinical cases, each carefully crafted to integrate biochemistry with the patient care. Every case walk you through history taking, physical examination, provisional and differential diagnosis, investigations, treatment, and even possible complications. You will also find early clinical tips and early practice sheets, which serves as your early training to practice and guide you in building professional habits alongside your scientific knowledge. More importantly, this book includes the attitudes, ethics, and communication, which we call it as ATCOM competencies, ensuring you are trained not only as future clinicians but also as empathetic communicators and ethical professionals. This book has been designed primarily for first year MBBS students, but it is equally valuable for nursing students, allied health science professionals, and even postgraduate aspirants who wanted to strengthen their clinical reasoning in biochemistry. Faculty members will also find it very much useful as a teaching resource aid to integrate basic sciences with clinical practice more effectively. I encourage you not to treat this book as just another textbook. Use it as a companion in your journey, to correlate your lectures with real-world cases, to practice your clinical reasoning, and to reflect on human side of medicine. Because in this technologically advanced era, the humanism is missing. So you have to bring back the humanism into the clinical practice. Read the cases actively, discuss with them with the peers, and think about how you would approach the patient yourself. That is how biochemistry will come alive for you. Behind every lab value or biochemical pathway lies a patient and family waiting for answers. By connecting science with clinical care early, you will not only learn better but also grow into compassionate, confident, and competent doctors. I hope this book supports you in that journey. Thank you, and I wish you all the very best.